Hi, welcome to Snackable Health with Gibson and Kohli, and we're talking about reducing nicotine in cigarettes. Big week with the CDC FDA guidance on this, right?
Yes, Mike, what we're seeing is the FDA really taking a stand. So we've seen an important development where the FDA has really told Juul, which is, the biggest manufacturer of e-cigarettes, thought to have 50% of the market share, that they really need to stop and provide data that this is not causing, permanent, long-lasting harm, particularly because these products are mostly used in our children. So that's one. And then the second is that the FDA is suggesting that they may actually reduce the amount of nicotine in cigarettes, which we know would be beneficial because obviously that's the highly addictive part of the cigarettes.
Is vaping safer? Yes or no?
It's interesting. Vaping started out actually doing good, being a good thing because it was a way to get adults who were using real cigarettes off of those cigarettes because the nicotine content was lower. But what's ended up happening is it's become tobacco 2.0. And now our youth, and what we saw in 2018, 2019 was the middle and high school kids had the largest increase in the number of e-cigarettes, often not realizing that they're consuming so much nicotine because one cartridge of that Juul is equivalent of a pack of cigarettes or 200 cigarette puffs. So kids are now using this because it's cool, it's socially acceptable, peer pressure. There's lots of marketing directed towards kids. In fact, they're saying the flavors that the companies are picking are meant to target the youth. And once they start using it, because of the nicotine content, they start to get addicted.
So there's the addiction, but is vaping cleaner? I mean, are there as many carcinogens in vaping as there are in traditional cigarettes?
That's what's still a bit of a question because obviously, as you know, when you vape something, you heat up the oils and it creates a vapor. So does it cause less lung injury? Does it cause less oxidative damage, less potential for carcinogens? This is what the FDA wants to look into with Juul. They also want to look into something called genotoxicity, which is, does it alter your genes in a way, the expression of your genes that leads to bad outcomes that can affect long-term things like brain development and fertility? These are all question marks when it comes to e-cigarette use. And that's why I'm really glad that this has happened as a way to hit pause on this vaping epidemic and really try to get more data before we proceed.
Is it a pause or do you think it's going to be permanent?
They're appealing the decision. The company, of course, has decided to appeal the FDA's decision. I'm hoping that it's permanent, but I also know that there is an immense amount of push to get this back on the market. So at the very least, I want to see some compelling scientific evidence about what it actually means for our kids before we allow them to go ahead and start marketing it towards our children and creating these addictive behaviors.
And finally, what are some of the alternatives now, if you can't vape as an adult to get off of traditional cigarettes? What are some of the alternatives to get off cigarettes now?
That's the good news there. We have so many options. And I think this is something both adults and even kids who are vaping should start to think about because nicotine, when you don't consume it, can create cravings and it can create withdrawal symptoms. And that's part of the addiction cycle that makes it so hard to get off. But if you use medications, a combination of things, usually medications, behavioral changes, such as therapy and discussion, those types of things, as well as talking with your doctor about other types of things you can do, there really is possible, and many people have shown us that the nicotine addiction can actually be overcome, and those changes that occur in your brain can actually be reversed.
Well, this falls into the category of what could possibly go wrong. Here was something somewhat well intended to get people off nicotine, but went in the wrong direction. Thanks, Payal, and thanks to all of you for joining us here at Snackable Health.